This session is all about the rise of mobility in healthcare, rethinking today's patient care delivery and workflows. This session is very important because this session is all about how technology has become a primary component in managing patient care, staff processes, and office productivity. Everything is digital and everything is mobile. Communication is the most important aspect of healthcare and is often what makes a difference when lives are on the line. Mobility becomes vital as doctors and nurses need to have access to communications tools on demand to organize care and call for assistance. The rise of digital patient record system has allowed doctors and nurses to use laptops and tablets for patient diagnosis and documentation. Mobile applications are helping medical offices, hospitals, and assisted living staff members to deliver prescription information to pharmacies, submit insurance claims, and even deliver real-time information from patients' pacemaker. So this session will discuss all aspects of this, the rise of mobility in healthcare, rethinking today's patient care delivery and workflows. And for that, we have eminent speakers who have joined with us. Let me introduce to all of you Dr. Nandakumar Jairam, former chairman and CEO of Columbia Asia Hospital and independent health advisor to Manipal Group. We welcome Dr. Nandakumar. Thanks for joining us today. We are joined by Yateesh Wahal, Executive Director, Vimhans Hospital, Nayati Group of Hospitals. We welcome Mr. Yateesh. Thank you so much for joining us today. We're also joined by Dr. Uma Nambiar, Executive Director, Gimcare Super Specialty Hospital and Chairperson, DHI India Association. We welcome Dr. Uma. Thank you so much for joining us today. We're also joined by Mr. Neeraj Lal, Group Senior Vice President, Medicover Hospitals. We welcome Mr. Neeraj. Thank you so much for joining us today. We're also joined by Mr. Devanand KT, CEO, Aster Prime Hospital. Welcome, Mr. Devanand. Thank you so much for joining us today. We're also joined by Bhoopendra Solanki, Head IT, Sakra World Hospital. We welcome Mr. Bhoopendra. Thank you so much for joining us today. And I am told that we'll be joined by Dr. Aloke, Group CEO, Omni Hospitals, shortly. With this, let me take the first question, Kumar Jairam. Mr. Jairam, my question to you will be that new ways of healthcare service delivery in the new world order through mobile and remote work operations. If I may ask you, what are the challenges and what are the opportunities when we talk about this new dimension to healthcare delivery?
Good afternoon, everybody. It's a pleasure to be here. And let me first start off by saying that remote medicine and mobile technology is racing far and wide to kind of support and completely change the landscape of healthcare. But like anything else that is a new venture, there are difficulties and issues, and one needs to kind of look at all of these. Let me classify this into two categories. Classify this into from the patient side and from the provider side. And let me take the patient side first. The challenge that we have from the patient side are several. Firstly, the inability of the entire population to be able to access everything and anything on the system or the phone is indeed an issue. The second is an difficulty for them to accept not having a face-to-face connection. And the third is that they have difficulties in accepting that a complete and total cover can be managed on a cell phone or digitally. On the other side, however, if you look at it from the advantages to the patient, there is an opportunity for every patient to be able to be a part of the healing process. So let's say a diabetic or a hypertensive can actually, through the system, not necessarily access a doctor, but take his own blood pressure, sugars, and control it on his own by understanding what is required. That, I think, is one of the biggest advantages of reducing costs, reducing the time constraints to the patient, and so on. On the physician side, the reluctance to accept technology still exists, especially to some of them who are more senior consultants. They find it difficult to adopt and change their way of thinking. For the younger consultants, the situation is a little different, and many of them are technologically sound and forward thinking. On the provider side, again, not every provider is happy or willing to invest into technology into the forefront. And the last point that I'd like to say is that a large number of technological solutions have evolved. And I think it is important that we understand that there needs to be some kind of a governance to decide standards, appropriateness, safety, and accuracy of these. So this is my 2 cents worth on your question.
As you have rightly said, Dr. Nandakumar, that reluctance to adapt to new technology, there's still that gap is there. We have to now quickly shift that or bend that mindset to adopt technology for better healthcare delivery. Also, a very important point raised by you, I'll come back to on that standard operating procedures has to be there, safety, security, a governance. You mean overall a governance has to be there when we talk about using technology and innovation in a better way. I think that's quite important part raised by you. I'll come back to you. Let's have a perspective from Dr. Uma Nambiar. Dr. Uma, your thoughts on this?
Hi, thank you for having me here. I agree with a lot of things that Dr. Jayakumar has, Dr. Nandakumar has said. See, from what has happened is that although digital technology has been considered as what will be the tool for transformation in healthcare and improving quality and access, but the circumstances in which there has been an exponential growth in adoption has somehow been very challenging. I mean, it is because of the pandemic that people are being forced to use. So clearly, at this moment, there is an element of chaos in the environment because there is the need for adoption is far too quick. The number of solutions, like Dr. Nandakumar was saying, there are far too many solutions that are available in the market, and the right solution to the right user, that match is not happening. We don't know what all is available. So there is although there is a huge demand, and also on the supply side, there are a lot of solutions available, but the demand and supply are not really reaching together, and there is no way to find out where you can find them. And the unregulatory environment and that framework in which this entire thing is mushrooming is a bit dangerous, because although we have, rudimentary some telemedicine practice guidelines, we know that the PDP bill is in the pending. We know that there is a lot of work that is being done in the NDHM framework, and all of that is happening. But I think the regulatory guidelines and framework is a little slow to catch up. And if we are not able to fix that, what will happen is that a lot of well-meaning, technology innovators and entrepreneurs will be devising solutions which will eventually not meet the regulatory framework, and they will suffer losses. And at the same time, the patients and the doctors will not really know. They will have that sense of insecurity, and they would not be able to. They will be penalized for adopting some technology in the wrong way because they don't meet the guidelines. And it's a challenge for the hospitals and the doctors on one side. And one thing that I want to really say, I mean, the question about data security and safety is so huge, because, and right now, in the absence of all the guidelines, the healthcare provider and the doctor is sort of de facto, the security keeper of this data. It is expected that they will know what is to be done, and if there is any breach in the data security, the hospital or the healthcare provider will be penalized for it. There is, there's no accountability of the person who's the technology partner. So the lack of such framework, and as I said, that if we don't do the governance and the regulatory framework quick enough, this whole thing will get messed up. I mean, we are living in chaos, and the chaos will never get sorted out. But in my mind, this is if once it is sorted out, it is the best way to move forward, and the best, transformative tool to improve the quality and access of the healthcare and also reduce the cost. This is the dream that we have been, waiting for, but we need to do it correctly.
Taking cue from what you said, Dr. Uma, that doing things correctly. This is the need of the hour, that we have to do this, but we have to do it correctly. And for that, unregulatory framework is a concern, as you have rightly pointed out, and data security and safety. And you'll be glad to know that we have been discussing all these important points for last 3 days in various sessions. We have tried to cover all these concerns, and we'll be documenting the outcome of these 3-day deliberations, and we'll be sending that even report to all the stakeholders, be it in government, be it to the healthcare professionals, so that some action can be taken based on this discussion. So that is our motto. That's the vision with what APAC is working. I'll come to Dr. Uma, but let's have a perspective from Mr. Yateesh Wahal. Mr. Yateesh, your thoughts on this particular, that mobile and remote work operations is a reality now. Where do you see India going, and what are the challenges? What are the opportunities?
So, Souvik, adding to what Dr. Nandakumar and Dr. Uma shared, mobility solutions always existed. The acceptance is where the challenge was, both at the patient end as well as the caregiver's end. And the constraints that have been pointed out as far as the caregivers was concerned, healthcare is a rather cost-sensitive industry, and unless it was a push come to shove sort of a situation, it involves a significant amount of capex outflow, both in terms of the hardware that has to be centered around rollout of all these services, because typically all of us are chains, and therefore we would want this to be a standardized offering across all centers, and we want interconnectivity, which requires a lot of servers and then licenses and then data security, data protection. So that is one aspect of this. Maybe pre-COVID, this sort of mobility was more towards accessing remote corners of the places or cities and towns where we were present, or districts where we were present, more from a CSR perspective, that well, we could go in for cardiac camp with these remote ECG machines with low bandwidth constraints. So currently, just the previous speaker, despite we being in metros, bandwidth still today remains a major challenge. So the universe, and therefore we all get after the CIO. So I see Dave smiling away, and even Bhoopendra, because the CIOs really get jacked and we get after their lives. Now, what has fortunately happened because of COVID is that the caregiver, the senior ones especially, and we didn't want them to be there at the facility because they were at high risk. Yet after a point of time, it was a situation wherein they didn't know what to do at home. They wanted to actually contribute. Their patients were suffering. At the same time, the patients didn't want to come to a hospital for fear of contracting COVID, irrespective of what the protocols were being observed. There was a stigma and a psyche associated with a hospital. So suddenly this model evolved. And there are many connected pieces to this. So when you come to a hospital, we give you a prescription. Obviously, you will go and get some tests done. You will go and get some radiology, some diagnostics. So those were missing links. Today, fortunately, because of again the way the environment is evolving, there are private players now, and we've entered into these agreements, and I'm sure the others in the panel have too, wherein someone like a My Healthcare has also gone ahead and done a back-end tie-up with, say, a Lalpath or a Pathkind, where even the tests, etc., that we are prescribing, back-end gets connected with the service provider. We get an end-to-end report. So our clinicians are connected as far as the entire ecosystem is concerned, and from a strategic standpoint, in terms of the revenue for the hospital, even that is accounted for. Yes, another very important point which I think has been discussed in your 3-day talk show has been the regulatory scenario. See, regulation was a very, very major drawback. We were not sure till these new guidelines at least were enacted and brought in because of COVID, that are we safe? Is the caregiver safe in terms of giving prescriptions online? What happens if there is a mortality or a fatality? The caregiver is at huge risk. The hospital is at huge risk. There is a grave medico-legal risk that is there. those guidelines, though still they are evolving, but there was some sort of a protection that was given to the caregivers. So that also strengthened the hand of the caregiver. And as a result, these very constraints that were there. So, if you were to list out the constraints that were pointed out, one is cost. Models have evolved today where smaller players can go in for a pay per use, even the larger ones if they want. So you don't have to really invest in the software or the hardware today. So you can absorb and involve technology without really getting into the hassles of ending up cutting high checks towards the acquisition of the entire solution. Yes, the standardization is a challenge, but the policy is evolving. There are branded players backed by private equity sponsors in the market who are coming in with these products which are getting absorbed. At the patient end, because of COVID, they've started to accept that yes, this is a doable solution, and at least if not the first, the follow-up visits can take place via the online channel. The caregivers have also matured to a scenario, especially post the second wave, where we wanted to do most of the work via an online platform. Even the TPAs, the insurance companies, have evolved in the second wave. They said we don't want physical papers or bills to be sent to us because they are coming in from a COVID environment. We don't want to touch them. Please scan and send them over. We are happy, very happy processing these bills over. So, those very constraints which challenged us from going totally online or paperless, suddenly because of the change in environment, the situation itself is leading to those enhancements both at the caregiver end, the processor's end, as well as the patient's end. And I see this coming up in a very big way because this is opening up the market in the true sense, and we are no longer just using telemedicine as okay, we have it to it is a very, very essential part of our service delivery. EICU was a very modern day concept. Today, in the remotest corners where people didn't have ICU setups, you have a Gurgaon setup or a Delhi NCR or a Bangalore setup extending care by treating those patients, monitoring their vitals in the ICU, ventilated patients through a remote center, and the RMOs or there are trained staff that can go in and intubate the patients at the bedside, yet the monitoring is done on the other end. So these concepts have become a reality, and the regulation has evolved and has supported us to bring this and make this possible. Having said so, it still requires a lot of evolution and fine tweaking. And I'm sure with forums like APAC and some of the other forums, wherein we are representing and getting the points that have been missed out because this policy obviously came in a very short span of time and requires evolution. I'm sure it will stabilize in the next few years. The CIO's role definitely is more important because data safety and patient safety, patient records become of immense importance because suddenly you now have situations where our networks are becoming vulnerable and everything is online. So those things and those modules, getting them built around the firewalls, whether you go in for in-house servers or go in for Amazon servers, those are frequent discussions happening in the boardroom where the CFO gets after us, boss, we are putting in a lot of money. And at the same time, as CEOs, we have to balance that, saying, boss, we have to also run the business and cater to the patient requirement. And the CIO is getting pulled in between both because he's got to get us the solution as well as he's the finance guy is happy. So it's evolving. It's a good situation to be in. It will benefit everyone in the long run. And actually, with all these things being available, see the power of having your records available with you at the click of a button. You can go in for a consult anywhere you require. You are no longer required to carry those bulky folders and films with you. It is all available at the click of a button. You send it to wherever you want, and it will help and aid the treatment process and
Right.
benefit the caregiver as well as the patient.
Right, right. It was good to see that Mr. Yateesh was wearing the hat of both CEO, CIOs, and CFOs, and that's a very important point raised by you because, by the way, because Uh, uh, as you have said that we are all evolving with the new world order norms, and that synergy has to be there, because end of the day, adoption to new technology is no more a mere option, it's a necessity. And I think the sooner we all realize that, obviously regulatory framework has to be there. As you have given the example of telemedicine or EICU, maybe 2 years before also no one would have thought that this way this can be done. But see, in last 1.5 year, how the entire things have changed. The famous saying goes that sometimes it takes years or decades to change. Sometimes it happens in just weeks. I think that was what Mr. Yateesh was trying to say. Thank you, Mr. Yateesh. I'll come back to you. Let's have a perspective from Mr. Neeraj Lal. Mr. Neeraj, your thoughts on this?
See,
Challenges, opportunities of mobile and remote work operations for
yeah,
hospitals.
actually, shockingly, healthcare is the slowest adopter of technology, being just second to shipping. I always believed healthcare is the slowest one, but thanks to this pandemic, COVID, and all, it has accelerated the adoption of technology and the penetration of mobile healthcare. This I think this pandemic has taught us to how to stay in the business, continuous use of digital platform for the patient care benefit as well as from the management bandwidth. See, I'll just talk some practical part of healthcare which we are experimenting in our hospital, Medicover hospitals. Here we attempt we should minimize the use of Excel and use various mobility solution in order to see the business, monitor the business, and growth of the business. Say, for example, we have one app which is digitally I Assist at Medicover. So whenever a patient is getting admitted to our hospital, he with the help of this app, he can have food, he can have maintenance, any problem which he is facing while on the bed of the patient, he can access. And the direct call when somebody is not coming goes to the call center, raises to the CO level and address. So there is no call bell system or something like this. There is I assist at medicover.com. Our entire purchase module, see purchase module, the intending for 18 hospital, we got hospital in Andhra, Telangana, and Maharashtra. Entire supply chain module is on mobile app. So what do we do? Any indent raise in one part of the city and state, it is approved by a escalation metric, right from the unit head to a head of the institute, coming to the corporate office and approval, as well as you can sign the purchase order online. So now no WhatsApp, no mails, and everything is there. In fact, if you see we are graduating our audit process from the manual one. If you must be seeing whenever any audit is happening in the hospital, both from the quality perspective as well as from the finance perspective, the auditors, all the quality managers used to mention these points on Excel sheet, and then spreadsheet is sent to all the people. Here we are in the process of developing an mobile app where all the audit observation is put up, and it is raised to a different vertical HOD to close the non-compliances in a stipulated hour. In this pandemic, what we are talking about mobile health, we feel patients are not coming to our hospital. We have launched a home healthcare app which is known as Medicover. So billing is happening, even health checkup are happening at home. Now nobody is coming to the hospital for health checkup. So with the help of this Medicovered app, which is a mobile app available in both the platform, we are doing almost 8 to 10 health checkup per day. So I am telling mobile technology is happening. Both it is benefiting the patient care also, and you can control the business also. Say for example, pre-COVID time, less than 5% doctors are doing e-consultation. Now over 40% they are doing e-consultation. We have a prescription tracker also. So how many patients which have taken the services of pathology, radiology, and pharmacy. And with the help of this app, we can monitor how many are defaulters. So people always call them. So I think digital technology is there, and who will adopt, how soon they adopt, they will be in the healthcare. So that's all for me regarding the use of e-health and mobile health.
Right, Mr. Neeraj, that when you said that health sector has been one of the slowest adopter of technology in the past, and how quickly pandemic has changed that, and the change has been done for good. And as you have said, and given examples of what you're doing in your hospital there also, how mobile app and digital technology is helping both for patient delivery, healthcare delivery to patients, as well as running of the hospital, the efficiency, the cost effective, everything plays there. I'll come back to Mr. Neeraj. Let's have a perspective from Mr. Devanand KT, CEO, Aster Prime Hospitals. Mr. Devanand, your thoughts on that?
Yeah, thanks for having me here. So, the esteemed panelists have covered most of the topics. So, but I think most of them focused, other than Mr. Neeraj, focused on the challenges. So, when we used to, as a young adult, when I used to watch a movie called Terminator or The Matrix, I always used to feel, how is it going to all this going to happen? It's like such a kind of a difficult universe they create. And there was a particular scene where a robot was implanted in somebody's stomach to make him into in a kind of different reality in the movie Matrix. Now we are talking about smart pills, which can actually do that, and inside the body of a human, monitoring his medicine adherence and the kind of things that different medicines does to his system. So we are moving towards that kind of a technology. Sometimes it's a little unbelievable and gives some kind of worrying factor also to it. But at the same time, like Mr. Neeraj said, if you don't adapt to the technology, you will be left behind. So there is no question about it, because the world is moving like that. So while we look at the challenges, there are a lot of challenges. Yes, of course, when we look at the adoption of the telemedicine or the mobile health, or when we talk about the sensors, the remote monitoring devices, there has been a lot of advantages also. See, for example, a patient, when he wanted to see a doctor pre-COVID, as COVID obviously has fastened the whole process, but at the same time, it has also given so much of convenience to the patient. Say, for example, a patient who wanted to see a doctor in an OP had to travel, wait in the hospital for some time, and then meet the doctor. And the FaceTime that you used to get was very, very minimal, right? The doctor will meet him for 5 minutes, 10 minutes. Now he gets the same FaceTime without, having to travel or to wait or to do a registration at the hospital. He gets it the comfort of his home. So that's what the real, technology advantage that is brought in. That's one. Second thing, on the other side, were all the data related to his patient, the particular patient or his family is in a particular domain where he can access all the information, and he can represent it anywhere. Not only the same doctor, he can always take a second opinion also. Since it's digital, it's very easy to share and get an opinion from some other doctors. And from the health provider side, it has also given a lot of data centric focus. Basically, when we used to do a lot of things with papers, now since most of the thing happened through the digital mode, the documentation, the purpose of having a space for MRD has gone down. That's one. Second thing, you can connect the data and make a lot of good inferences, use that data for research. These kind of things have come in due to the introduction of these technological initiatives. And more than that, now patients also have different options, where they have, say, for example, there is a website called Patients Like Me, which actually, shares their experiences related to a particular disease, how they managed it. They can also share their experiences about their diagnosis, the kind of hospitals they went, the type of treatment they went on, and they can, the other patients can also understand from their experiences. So this all has been possible due to the technological things. And then another thing that the healthcare always have been facing, especially the clinicians have been facing, is the medicine adherence, where patients never used to take medicine on time. They skip some medicines and all. There were a lot of companies who've come with technologies where they give alerts to the patient. There was a company who mentioned that there will be 2 alerts going to the patient, and then the patient has to take the medicine and report in the app that I've taken the medicine. Otherwise, he'll get a call again to ensure that the patient is sticking to the medicine and the regime prescribed by the doctor. So all this has given so much of importance to the patient care outcome and convenience. The technology is definitely there, which we have to adopt. At the same time, yes, there is always the risk of data getting overload data and security, privacy of data. All those things are there, especially in a country like India. Other than that, the patient record is also very, very fragmented in India. We don't have a universal system to capture the entire data. It's totally fragmented. So probably in many other countries, the data, they all moved into the electronic medical records, very early. India is still to come to that level. So once we reach that level, this will be huge beneficial, especially for people to consolidate the healthcare support to the patients, and also especially in rural or backward places where the healthcare is still the proper healthcare or the support or the follow-up of the healthcare becomes a real difficult scenario. So I think technology is here to stay, like Mr. Neeraj and other esteemed panelists said. It's how we adopt it to the convenience of the patient. But I'm also a hard believer of the human touch that we are losing due to this technology. So we have to probably have a via media where human touch is also, probably we don't know. Tomorrow there will be a technology that comes where the doctor can virtually touch the patient. So that also may come in. So that I think is getting lost, but I think there will be some solution for that also. Thank you.
Right. Thank you so much, Mr. Devan, because but interesting points raised by you, especially when you talk about the fragmented data, which is a concern. And there's no shying away from technology, but I think you have touched the right chord when you said that not only you're missing, or you will be missing, many of us will be missing that, are missing that. But I think there will always be a hybrid model for future that we call it digital, that physical and digital, that will be that marriage will be the new norm, more in a more way. You talked about the data collection. See, I'll just give you two examples of Arogya Setu and COVID. Just see how using technology has being the game changer. When you talk about Arogya Setu or COVID, almost 60 crore people have been vaccinated in India. Entire data is in there in COVID. So that kind of integration is being done in India, and I think that's also a very good prospect for India's healthcare future. Just that it has happened with Passport Seva, e-passport. 10 years back, getting a passport was a pain, but see how it has transformed. One of the best e-governance example of the country. Same has been done through Arogya Setu app or COVID. That's my personal opinion. You may differ, but that can be the actual strength of using technology and data in a proper way. I'll come to you, Mr. Devanand. Let's have a perspective from Mr. Bhoopendra Solanki. Mr. Bhupendra, your thoughts on this particular question of mobile and remote work operations, opportunities and challenges. If you can unmute your mic, please. And I think we're also joined by Dr. Aloke Mullick, Group CEO, Omni Hospitals. Dr. Mullick, welcome to you. Yeah.
Thank you. Got stuck in an emergency, so I
No
missed
issues. We'll
some of the
come back to
deliberations
you after
earlier on.
Mr. Bhoopendra. So let's have a perspective from
Thank
Mr.
you.
Bhoopendra.
Yeah, good afternoon, everyone. So it's an interesting subject for the discussion. Being a head of IT and taking care complete IT operation for Sakra World Hospital. Yes, I'll divide the mobility or remote monitoring or remote care for the patient in two segments. One is B2B, one is B2C. So B2C is a vicinity, you can say, but B2B, you can reach the remote area as well with the small nursing home tie-up, or you can set up your satellite center and then approach the remote area. In that, yes, adaptability, as other peers told, Mr. Neeraj and Dr. Uma and other peers told about the adaptability. It is still a challenge. We have to educate the people. I'll put some statics data like before COVID, around 5 to 10% transaction happening through remote care. We have a home care service as well. Still, we have find out only 5 to 10% transactions happening through remote care. After COVID, it's got increased to 50 to 60% transactions through remote care. Thereafter, now these days again, it's reduced to 20 to 30%. And one example we'll give, one patient given a feedback, like doctor taken a full fee, but he not touched even single time to assess the problem. So still the human touch is required for to give the patient comfort. So that mind change is required in across the nation, or even we can say across the world, to utilize the technology. These days, technology is the business enabler, not the burden. If you see 20 year or 15 year ago, technology feels like it's a burden, it's a cost factor for the organization. Okay, whatever necessary, just run that and move forward. But these days, it is not like that. So, being a solution identifier, provider, implementer, so we have to think in consolidation of services. In these days, because of the COVID or the opportunity, many players are in the market to give you solution in terms of remote monitoring, remote vital testing, video conference, video consult, like that. But single platform to fulfill all the requirement, it is difficult. So whatever solution we explored or we thought, still it is a bit and pieces, not the in single platform. So that manner, with the pressure of management, like right time and then before time, we have to implement and get the complete. So in that manner, single solution with single platform are difficult to identify. Caregiver also worried about the touching the patient or non-contact transactions. Like, so we enable many things to enable contact less transaction in our organization, which helps the patient as well as the caregivers. So mobility plays an important role these days, but adaptability still is a challenge. That some campaign or some awareness program should go about the use of technology, and they can have similar kind of comfort or care to take the care through the help of technology, instead of going physically to the doctor. If it is post surgery, they can take a consult over the video consultation and all. So that way it help us a lot, in my view. But yes, to reach in remote area, that technology give you a better platform. It's still like connectivity, the bandwidth issues, and consolidation of services. These challenges still there. So here I want to say, the awareness program should go across the nation to adopt the technology. That's it from my side.
Thank you so much, Mr. Bhoopendra. You've rightly said that uh, adaptability and changing the mindset is a problem, is a challenge. Dr. Nandakumar also said that in the beginning, and uh, also the infrastructural challenge when we talk about remote workforce, whether the connectivity is there, bandwidth is there. So a comprehensive policy from government's part has to be there, and that infrastructure has to be there, no doubt about that. And also creating awareness program for fast adoption of digital technologies nationwide. That's also a very good suggestion. Maybe government can work on that. I'll come to you, but let's have a perspective from Dr. Aloke Mullick, Group CEO, Omni Hospitals. We welcome Dr. Mullick. Uh, what we're discussing for last 1 hour was that new ways of healthcare service delivery in the new world order through mobile and remote work operations. What are the challenges and opportunities? Your thoughts on that? Over to you, Dr. Malik.
It's a huge opportunity, obviously. If I suggest everybody in the healthcare sector reads a book called "The Patient Will Now See You," right? So in all industry verticals, the patient is used to consuming the product or the services concerned through his mobile. Now, mobile doesn't need any, I mean, even the villagers have smartphones now in the villages, and they consume a lot of content through various apps. And we did a small pilot in a hospital where we asked our doctors to use a mobile-based EMR. They were up and running within 2 days because everybody is so used to mobile. Everybody is so used to the mobile ecosystem. We spend virtually, most of us spend 6 to 8 hours, 4 to 6 hours on the mobile every day, right? So it's just another app. But the point is that hospitals, for some unknown reason, and some very nice applications which are basically mobile based. I tell all EHR EMR vendors, if you don't have a mobile application, nobody's going to pick you up. You can have a great desktop application, you can have a great thing on iOS and Windows and all, but unless it's on mobile, it will not work. Doctors will not work on it. That's the current, and the patients will also not work. So you need a good patient app, you need a good doctor's app on the mobile, and not many, but a few such really brilliant apps have already come up in the country, and the hospital which adopts them first, they will hit a gold mine. I just don't know why hospitals are not investing money in this. I just don't know. Of course, nothing will come cheap, and courtesy the COVID pandemic, the government also moved in fast and made remote healthcare monitoring, telemedicine and all, everything is all legal, the laws are there, so you're all protected. And the next journey for any hospital is the journey to the mobile, because the patient is now ready to see you. Are you ready to see the patient? Right? It's a play on the word, the doctor will now see you, the patient will now see you. I suggest all healthcare managers must read that book. It's a beautiful book. That's the new emerging paradigm for healthcare across the world. The hospitals which own the mobile space will own the patients in the future. I've got no doubt in that.
A very interesting perspective by Dr. Aloke Mullick. Hospitals who owns the mobile space will own the patient's space as well, and probably that also corresponds to what the data shows. That data shows that Dr. Aloke Mullick was talking about mobile phone penetration, the smartphones, and India is number 2 in the world in terms of using smartphones, right after US, and they say that by 2040 the number will actually double up in terms of smartphone users in India. And it's also a fact that in villages also smartphones are there, and they're already having a lot of content. How can we integrate that gap that we talk about reaching to the last mile, healthcare delivery through mobile phones, even in the remote places in the village or difficult terrains? And hospitals have to adopt to that work mode as well. That was Dr. Alok Mullick was saying. We have come to the end of this panel discussion, almost at the end of this panel discussion. But before that, let's have a perspective from all of us, all of you, maybe 30 seconds, a minute or so, that if I may ask you that, what is the future of India's hospital infrastructure? Will it be only digital, or it will be a marriage of physical and digital? Or again, the digital penetration will go down when the things are normal, will be again back to good old days of only physical and not using technology in that way? So these 3 options quickly. Let's have a perspective from Dr. Nandakumar Jayaram. 30 seconds to you, sir.
Okay, very clearly it will be a hybrid of digital and physical. There's no question about it. Adoption is taking time, but I share the enthusiasm and optimism of many of my co-panelists, and digital is here to stay. It will also standardize over a period of time, like everything else. And finally, what I would say is adoption will occur. Even our villages will adopt to it. It's only a matter of time and directing our energies in the right direction to ensure appropriate involvement of the digital in the physical space.
Right. Thank you so much, Dr. Nandakumar Jayaram. Dr. Uma Nambiar, your thoughts on that quickly. If you can unmute your mic, ma'am, please.
I'm sorry. So I totally agree with Dr. Nandakumar, and I feel that if there is a carpe diem moment for the healthcare industry to seize technology, this is the time now. And in terms of how the future will look, today what I find is many technology solutions develop technology, and it looks like tech for healthcare. It has to be the reverse. It has to be tech for healthcare. Today what is happening is healthcare by tech. So the technology solution providers decide what the hospital needs, and they give you the solution. And instead of being 2 different departments, the health tech will become a single unified entity, is what I foresee. That's how it will happen. It will become a merged single unified entity.
Right. Thanks, Dr. Uma Nambiar. Mr. Yateesh, Wahal, your thoughts on that?
Well, Souvik definitely is there to stay. And whilst the numbers of, in terms of digital usage, may have dipped post COVID, it has definitely doubled or tripled than what it used to be pre-COVID. IoT and wearables are very much in now. You don't need to really be carrying ECG machines or even Holters. Those wearables are something which are able to give the cardiac department, for instance, a complete run through on their patients. Likewise, AI is playing a big role. Even in COVID, the AI, as far as the CT scans were concerned, were able to pick up and immediately relay to the clinicians that, well, it's a COVID, it became a gold standard, even better than an RT-PCR. So it's here to stay for sure. And all of us are adapting to it. And it will stabilize, the norms will evolve, the regulatory scenario will evolve. It's here to stay and for good.
Thank you, Mr. Yateesh. Thank you so much for your insights. Mr. Neeraj Lal, your thoughts on that?
Yeah, I beg your pardon. What you are asking, Mr. Souvik?
So my question is just 30 seconds to you. We're ending the panel discussion. My question to all of you was that what is the future? Physical and digital both, or only digital, or again we'll come back to physical days
No,
in terms
okay.
of
See, I think it will be a good mix of physical versus digital. In healthcare is always is a human touch. I was reading one article which talking about goodbye to the physical examination. So I think it's a good mix of physical as well as digital technology. But we have to see the right mix of it. I think remote monitoring, ICU monitoring, use of various apps in the process of the hospital will increase the efficiency. But however, physical, it's also very important because I think healthcare human touch is key.
right. Thank you so much, Mr. Neeraj Lal. Mr. Devanand, your thoughts on that? You when you spoke earlier, you gave example of Terminator. How will you end?
Yeah, that was not a pessimistic, note. I was saying that technology is here to stay, no doubt about it. So my prediction is that in next 10 years, the OP business will vanish. 80% of the OP business will vanish from hospitals. This all is going to be digital. Where Mr. Neeraj already said that the health checkups happen in the home now. EICUs are being set up in the home. Dialysis can be done at home. You can do even ultrasound was one thing where the patient had to come to a hospital. Now that also can be portable. So a lot of things have come home to the patient. So many people will start using that, and then that OP business will vanish. Same way, rehabilitation, long-term rehabilitation, physiotherapy support, all these things, people used to come to hospital, all those beds will be vacant. So I think hospitals will have a lot of space. Probably we can re-engineer our space to use it to more productive other things, or probably reduce the space also in order to accommodate only the IP care which is required at a hospital. OP, there is no doubt that OP is going to vanish. Probably lot more standardization, more acceptance, not only from the patient side, from the provider side, especially the doctors and the other staff, by providing more training and more awareness. I think it's going to really pick up. That's my version. Yeah, thank you.
Thank you so much, Devanand, Katie. Interesting perspective yet again, and I hope that we all listen to that and work on that more. That let's have a perspective from Mr. Bhoopendra Solanki. Mr. Bhoopendra, your thoughts on that?
Yeah, it will be remains hybrid actually, at least for 5 years. It is not possible to replace the human touch with the technology. So definitely it's going to hybrid. But yes, technology will help to provide a better care in minimum time. So that helps always, and it will going to evolve time to time. Means whenever the new technology, new features, cutting edge technology coming in, that will help. But technology can't replace the human touch, so it will going remain same like hybrid. Hybrid ratio can be reduced, but still it will be there.
Right. Thank you so much, Mr. Bhoopendra Solanki. Dr. Aloke Mullick, your thoughts on that? The future. How do you define future?
Let us understand one thing very clearly, that computers can't treat patients. So you need doctors for them, right? So Doctors will continue to treat patients. What we're discussing is how the patient information is getting managed, right? Now, this new program by the government, the NDHM, it's a great program. I hope it is well funded. I tried to create my own PHR, but it says currently it is available only in the union territories. So probably it's waiting for funding. Imagine a billion people having their own PHR on. See, ultimately the drive will be by the government. The government published the EHR standards version 2, version 3 is coming. Government has been threatening. I hear every year कि next year से आएगा. I have been hearing this for the last 10 years. That unless you have a standards compliant EHR, just like they did for NABH, that you will be docked 15% of your fee, right? It will 100% come. All the pieces have been put in place. It's just a matter for the government to now put the rule in place, and it is coming. It is coming. They've been threatening to do it, but I'm sure they will do it in the next couple of years. So, and the government hospitals, NDHM kind of see what we did during COVID vaccination. Massive IT infrastructure, all funded by the government. The same thing they are going to do for the NDHM. Nationwide unique health ID for each population person, and everybody, even if you go to the PSC, ultimately you will need your NDHM ID, right? That is the future. Ultimately, the government is going to drive it. Ultimately, a new set of regulations is going to drive it, and private hospitals will have to follow at that time, right? But
Right.
of course, doctors will continue to treat. Doctors will continue to treat.
Right. Thank you so much. That was Dr. Aloke Mullick. I thank all of our esteemed speakers who have been part of this panel discussion on the rise of mobility in healthcare, rethinking today's patient care delivery and workflows. I thank Dr. Nandakumar, Jairam, Dr. Aloke Mullick, Dr. Nambiar, Yateesh, Wahal, Neeraj Lal, Devanand, Katie, and Bhoopendra Solanki for joining us today. And if I take a synopsis of the crux of what have been discussed for last 1 hour or so, that regulation is a concern, we have to address that. Standard compliance of EHR has to be done, as Dr. Rupaniga said. Overcoming mindset to adapt to new technology, we have to get it done. There's no shying away from technology. Technology is the need of the hour. We have to embrace that. Data privacy, the moment we are talking about using technology, we have to think about data privacy, data security, the fragmented data, how to address that. We have to make a way out for that. And end of the day, as most of us have agreed that human touch will be there blended with technology. So I think that will be the future of India's healthcare infrastructure for future, and India will be ready to face any kind of pandemic. There are a lot of successful examples of using technology and also human intervention. I'm sure in coming years and months or so, this will be followed. So the marriage of physical and digital will be there, and that model will be there for long, and India will be ready to face any kind of pandemic if it comes again, hopefully. Thank you so much, Dr. Nandakumar, Jairam, Dr. Nambiar, Dr. Aloke Mullick, Yateesh, Wahal, Neeraj Lal, Devanand, and Mr. Bhoopendra Solanki for joining us today. Do join us for the next session as 2:50. That will be yet another session, second session of the 3-day APAC HealthTech Innovation Conclave, decoding the
Thank
future
you.
of the healthcare. Thank you so much. Do tune in for